CLABSIs Part 2. Impact and consequences of CLABSIs. Morbidity and mortality rates. Smoking can lead to serious complications and increase the risk of morbidity and mortality. In plain English, that means they can make you really sick or even cause death. Yikes! So, preventing and managing CLABSIs is crucial to keep patients healthy and happy. Economic burden of CLABSIs. Not only are CLABSIs a pain in the you-know-what for patients, but they also take a toll on the old bank account. Treating and managing CLABSIs can be expensive, costing hospitals and healthcare systems a pretty penny. It's like pouring money down the drain, except the drain is made of medical bills. Patient quality of life and long-term effects. CLABSIs don't just disrupt your Netflix binge-watching schedule, they can have long-term effects on a patient's quality of life. Complications from CLABSIs can lead to prolonged hospital stays, additional treatments, and overall discomfort. It's like that lingering annoying houseguest who just won't leave. Current research and trends in CLABSI prevention and control. New technologies and innovations. The battle against CLABSIs is an ongoing one, and researchers are constantly coming up with new and exciting tools to fight the good fight. From antimicrobial catheters to fancy schmancy dressings, there's a whole arsenal of high-tech weapons being developed to prevent these infections. It's like a real-life episode of CSI, Microbes. Quality improvement initiatives. Hospitals and healthcare organizations are also implementing quality improvement initiatives to tackle CLABSIs head-on. They're using data, checklists, and protocols to establish best practices and ensure proper infection control measures are in place. It's like giving CLABSIs a big ol' smackdown with an iron fist of quality. Success stories and best practices. Despite the challenges, there are success stories out there. Hospitals and healthcare facilities that have managed to significantly reduce CLABSIs through their prevention and control efforts are like shiny beacons of hope in a sea of infections. Learning from their best practices can help others follow in their footsteps and keep those CLABSIs at bay. It's like finding a treasure map leading to a secret stash of infection-free goodness. In conclusion, central line-associated bloodstream infections, CLABSIs, continue to be a significant challenge in healthcare settings. The prevention and management of CLABSIs require a multifaceted approach, including strict adherence to infection control practices, proper catheter insertion techniques, and appropriate antibiotic therapy. By implementing evidence-based strategies and staying updated on the latest research and trends, healthcare providers can work towards reducing the incidence of CLABSIs and improving patient outcomes. With continued efforts and a focus on prevention, we can strive to ensure safer healthcare environments for all patients. Frequently asked questions, FAQ. What is a central line-associated bloodstream infection, CLABSI? A CLABSI refers to an infection that occurs when bacteria or other pathogens enter the bloodstream through a central line catheter, which is a tube inserted into a large vein for various medical purposes. This can lead to serious complications and pose a significant threat to patient health. What are the common risk factors for CLABSIs? Several factors contribute to the development of CLABSIs, including prolonged catheter use, improper catheter insertion techniques, compromised immune system, underlying medical conditions, and inadequate infection control practices. Understanding these risk factors can help healthcare providers implement preventive measures effectively. How are CLABSIs diagnosed? The diagnosis of CLABSIs involves a combination of clinical presentation, symptoms, and diagnostic tests. Blood cultures are the primary diagnostic tool, which involves drawing blood samples from the patient and culturing them to identify the presence of infectious organisms. Other tests may include imaging studies and laboratory analyses to assess the extent of infection. What can be done to prevent CLABSIs? Prevention of CLABSIs requires a comprehensive approach. Some essential prevention strategies include strict adherence to hand hygiene, proper insertion techniques, regular assessment and maintenance of catheter sites, antimicrobial stewardship, and education and training for healthcare providers. Implementing these preventive measures can significantly reduce the incidence of CLABSIs and improve patient outcomes. Thanks for watching.